Amy Sparopoulos.
Okay, here's some real talk for you on this Friday. As we age, our bodies change. Our skin changes. Wouldn't it be nice to smooth those fine lines, make the skin a little tighter in places that are sometimes just a little loose, you know, from our neck to around our eyes, maybe even our hands. You know, my mother used to tell me, if you ever wonder the age of a woman, look at her hands or her neck. Well, what if you didn't have to wonder? What if you just thought, they're definitely 21? Joining us this morning to tell us how it might be possible to turn back the hands of time. Welcome this morning, Doctor, good morning to you. I love this. Face your hands. Doctor, thank you for joining us.
It's my pleasure. Thanks for having me.
Absolutely. Dr. Ellen Marmer, tell us a little bit about how we can turn back the hands of time.
I love that. Make sure you're in good hands to turn back the hands of time.
Yes.
So as you said, our face ages, our neck ages, everything on our body might age, but we've been pretty careful taking care of our face for a long time, but maybe we forgot to be taking care of our hands. So always think about putting on sunscreen, moisturizer, avoiding kind of picking or scratching your hands at all. But now it's great news that the same filler, Restylane Lift, that has already been approved in our face and in our nasolabial folds is now FDA approved to be safe to use as a non-surgical filler or non-surgical treatment for the back of the hands. And what happens to the hands is that we lose some of the thickness and volume of our hands, and our veins get a little bit bulgy and bigger. So my patients say, wow, you know, I'm starting to look really old here. I can't get away with lying about my age anymore. And so they say that their veins are prominent and that it doesn't look so good. So we can easily, in a very quick procedure, lift up the skin and inject a very small needle and spread the Restylane Lift, which is hyaluronic acid, over the back of the hands and give you that volume and that rejuvenation of your hands.
Very cool. I guess I really want to ask you, and I know the viewers at home do too, does it hurt?
You know, it's actually very mild. I mean, most of my patients are like, oh, that didn't hurt at all. Oh. The Restylane Lift has lidocaine in it, which is an anesthetic. So as you only feel a tiny little pinch, and it's the tiniest needle, like it's called a 30-gauge needle, very tiny needle, and it injects very quickly. So once you get just through that little poke hole, it actually doesn't hurt at all. Afterward, you could have a little tenderness, maybe mild tenderness for a few days. You might get a small bruise if you've been taking some anticoagulants like aspirin or Advil, so you could try to avoid those if they're not necessary for a few days. You could have normal swelling for a couple of days as well, but really over the first week or so, everything sort of settles in nicely. We usually see our patients back after 2 weeks to be sure everything's perfect, see if they need a little bit more. Sometimes there's that little area where you hold your wine glass that you want to make it look a little bit better. And then the study showed that the Restylane Lift lasted out to 6 months.
Wow, that's good. That's very good.
Yeah.
And talk a little bit, I'm curious, the wrinkles and tendons and veins, is that just a normal part of getting older?
It is. It's a normal part. You know, part of it is genetics. Part is the sun damage will thin out everything. Part of it is the veins actually do expand a little bit. They just like varicose veins. It can happen in the hands as well. So yeah.
Well, your hands look beautiful. Hold them up for us so we can see. They look gorgeous. Oh my gosh!
Thank you,
you could be a hand
Amy.
model. You could be a hand model, and I know there are such things. I've had friends who have done that. Thank you so much for joining us. You can get all of the information right there, RestylaneUSA.com. Coming up, the one and only McKenna Bray is standing by in our green room. She's getting ready to perform on our Levitt Shell soundstage. She's